welcome everyone. Thank you for joining us today in this webinar of the SPHR Network on Health and Risk Communication for Public Health. It's truly a pleasure to be here to present on generative AI and health information seeking. This session was born out of what I can only describe as a popular demand. So over the past year or so, I've received a lot of questions, a lot of requests from colleagues, students, professionals, and inside and outside the university about generative AI. I see there are some colleagues of mine in the room here. Welcome. So this is really much of a brainstorming session, if you want, but I prepared a presentation around different topics that I want to cover that are related to, that are important for health and risk communication. So I'm going to talk about what is generative AI, so how reliable it is, should we trust it, should we use it, and how do we use it responsibly, possibly, especially when it comes to health and health information seeking. So today my goal is to shed some light on both the opportunities and the challenges or the risks of using generative AI as a tool for health information seeking. So I'm approaching this topic from a different viewpoints, not only as a researcher of digital health communication, if you want, but also as an academic, as a reflective academic, and as an academic integrity officer, because I have a role in the University of Birmingham as a deputy academic integrity officer in my department. So when I see cases of misuse of generative AI, this is something that makes me think about how we promote the appropriate use of these tools. So I want to share what I learned from the evidence, from practice, and also from the interactions that I had with the different people in the past year or so. So to frame our discussion, I'm borrowing a simple narrative structure from Sergio Leone's masterpiece, The Good and Bad and the Ugly. For those who are not familiar, it's a Western. And this image was generated by Gemini, Google generative AI tool, the Nano Banana application. So why this structure? Because it mirrors the reactions that I've seen in real life, if you want. So the enthusiasm on one side about generative AI, the curiosity, at the same time the worry and the anxiety that surrounds AI use or misuse. So we'll start with the good, the part, the uplifting element, the one that is generally empowering people to use generative AI for health information seeking, especially for making what I would call complex health information, understanding health information. Then we'll turn to the bad, so the limitations, the misinformation, the moments when AI gets things completely wrong, and then the consequences of that from the health communication standpoint and research standpoint. Finally, the ugly, so the deeper structural problems, let's say, or the issues, the concerns related to the inequalities, the deep fakes, the propaganda, the environmental costs, and the geopolitics of AI. That shape, of course, the world in which we're living in and the tools operate. So each section will reflect different layers of impact, from individual use to the whole system. So throughout, I'll be trying to draw on my experience as a researcher, as I mentioned before, as a reflexive academic and an educator and academic integrity officer. So without much further ado, let's talk about why this topic and why now. So before we delve into the good and the bad and the ugly, I want to set the scene with a brief prologue. So over the past few years, I've been really deeply involved in training, teaching, and several conversations about generative AI. Not just because I set out to be an expert. I am not an expert in use. I am an active and proactive user, of course, but because the demand has been really overwhelming. So everywhere I go, I see people that receive or request clarity, reassurance, and guidance. So this started, let's say, a few years ago with a paper that Professor Doug Evans, who presented in the previous webinar, and Jeff French is the past president of the International Social Marketing Association, and I wrote about the increased use of generative or artificial intelligence in general for strategic social marketing. So in this paper, we reflected on various roles and ways in which AI can help social marketers and health communicators, of course, improve their work. So we spoke about supporting in conducting formative research, policy analysis, strategic development, so the development of strategies, and the development of messages or communication delivery. So this is why I approach this topic as a reflexive academic. This is not simply asking what AI does, but also what AI changes in the behaviors, the practice, and expectations of the public. Now, a few years ago, also, I started as an educator and academic integrity officer. I um, I created this, or I launched this initiative called the GROWL, the Generative Resources for Optimized Learning and Working, to help health science students in Birmingham engage with AI meaningfully, a bit more ethically, more critically, transparently also. So the aim of this initiative was to build AI literacy among the students. This work has shown, of course, that, and this was reflected in a paper we wrote with some colleagues of mine. So AI is powerful, but only really when paired with critical thinking and AI literacy. And I think this is a theme that will come again and again in this speech, in this presentation. So over the last year or so, and in the future, within this coming year, I developed several workshops or interactive sessions on the use of generative AI in different roles for different purposes. As you can see from the slides here, these are the conferences where I attended or I'm planning to go to and talk about these very topics. So how to use and learn how to use generative AI in a more critical way, in a more thoughtful and probably ethically sound. So these experiences made one thing absolutely clear. So we need really better tools, but at the same time, we need a better understanding, better literacy about these, and more transparent conversations about what AI can and cannot do. And part of it is really about having opportunities to talk about AI. And this is one of them, of course. So one thing I've observed through my work is that people tend to fall into three broad categories or archetypes when engaging with AI. And this is where I borrow the labels from current research from the Harvard Business School. So there are cyborgs, centaurs, and self-automators. These categories help us really understand not just how people use AI, but also why some users get value more than others in addressing health-related information. So cyborgs are just generally focused on knowledge co-creation. So they integrate AI in their workflow. They treat AI really as an extension of their own thinking rather than as a replacement. So they develop both the domain expertise and their AI skills in health information seeking. Cyborgs really question the AI, verify the outputs, refine prompts. They co-create knowledge with the tool. They go deeper in a way. So they question, they challenge the tools to provide accurate responses and verified responses, so accurate and valid. Centaurs are named after the mythological creature. These are users that tend to split the task between AI and themselves. They're in between, let's say, the roles that I'm going to present in a moment. They create controlled workflows where AI is used as a tool and but not as a decision maker. So they retain the ability to make decisions. So in terms of let's say this might be one of the roles that many professionals, communication professionals use today. So they increase their current domain expertise in health information seeking and content production, but they delegate some of the tasks. Finally, the self-automators are those who hand over the task entirely to AI without critical review. So they accept usually outputs as they are. And then therefore the skills deteriorate over time because we humans become lazier. So if we delegate everything, we tend not to we tend to do it again and again. So let's say we write emails, we send documents that are generated without any verification, let's say. In the context of health information seeking, this is the most dangerous category because these users may place full trust in the output. They will not question the source. They will not challenge the AI tool, even when the advice is wrong or risky. So there might be, because we are lazy and we tend not to spend more time, cognitive effort, and we don't want to put more cognitive effort in finding the truth, if you want. We tend to accept what it's there. It has, of course, implications for what we're going to say in a moment. So understanding these archetypes, these categories, really helps understand and how to understand how we approach generative AI as environment now of a new technology that is here to stay. So this helps us frame also the good and bad and the ugly that I'm going to talk about in a moment. So what should we become? I mean, for health communication and public health practice, we should definitely be we should definitely be cyborgs or centaurs rather than self-automators. So I hope this presentation really pushes you to think about that and to think about your role and your approach to generative AI. Centaurs also assign tasks, the liberty, and maintain human oversight. So the point is we need to bring back the human in the intelligence equation, if you want. Now, before we delve into the good and bad and the ugly again, I want to discriminate between, or discriminate to clarify the distinctive elements of discriminative AI and generative AI. So discriminative AI is, and this is what we had for many years now. So there are systems that classify and analyze data. So they are used for diagnostic, imaging, risk scoring, risk prediction models, outbreak detections. You know, these are rule-bound systems. So based on algorithms, if something happens, and AI will tell you, I mean, through machine learning, the device will tell you this is a situation at high risk, for example. So if you're seeing an image or about a breast mammogram, for example, and they will detect whether there's a case of cancer based on millions of other images, and will detect it with accuracy. So it's about pattern recognition. It's about determining whether the information is present in other cases used before. So discriminative AI takes inputs and categorizes it according to specific structures, does not create new content, okay? So in this case, discriminative AI lowers misinformation risk because the outputs are somehow controlled and they're already there. It's not generating new things, it's just telling you which element pertains to a category that is already existing. Whereas with generative AI, there are a set of tools that create entirely new content. We talk about text-based large language models, image, audio, video, right? So we can use generative AI to write everything now, writing patient education materials, visuals for health campaigns, providing multilingual information, translation, or similar. So they produce novel outputs that look authoritative, possibly, and they might contain fabrications or what we call them hallucinations. I'm going to talk about this in a moment. So let's start talking about the good. So how AI can be used for understanding health and illness. Now, AI has changed or is changing, has already changed the way people search about health. And here's a picture I took from the website of ChatGPT Health, which is a new system, a new GPT feature that is not available in the UK yet. But is available in the US. And they basically claim that people can then upload or connect their Apple Health or other electronic health record information so that they could use the tool to interrogate their own data and understand illness or disease before it happens. So is this good? Is this bad? I'm not sure. I mean, probably we don't know there yet, but it's something that is already happening, probably is not well diffused in the world, but it's something it's going to come probably very soon. So traditionally, we search Google. We use Dr. Google since the 2000s, say, or earlier than that, to find information about our own health. We typed information in Google, and we then looked at a ranking of information through the algorithm to the database that Google brought up. But with generative AI, we're moved to natural language conversations, all right, and in iterative reasoning. So already it's happening. This is based on a study, on a report by 802 So the AI and search behavior study. With generative AI, people no longer simply or look things up in Google or another search engine. They ask, they probe, they discuss, right? They tend to search information. So when you go to Google, you ask for different queries, probably you have different information, different questions in hand. So the old way, we search in Google, we had several content, several links ranked by relevance according to the search engine. Then on the side, maybe some sponsored content, some ads. In the new way, it's about synthesis. And probably you've seen that I have a slide in a few minutes. I'll show you what I mean by that. So you start typing a question in Google, you'll already have a summary of that answer that question. Okay. Now I'm going to talk about of another case, let's say, where AI could be useful for health information seeking. And so I want to share like a personal example here. So Luca Conti was a blogger I knew who's writing um, in a few months ago, documented his final months living with an aggressive stomach cancer. So he, in his blog, in this blog, of course, it's in Italian now, but he tried to understand his diagnosis, the therapy, by through the analysis of his own blog posts in the last 100 days. So Luca embraced generative AI not as a cure, of course, but as a companion that helped him understand what was happening to him. He was not rest in peace. It was not an expert health communicator. He was a blogger, mostly in business, or he was a journalist. But his story is meaningful because it shows that deeply, human side of AI. So you could really try to understand something that is unclear to you, especially when it comes to big important life decisions or big important life events. So use AI tool or different tools. I'm going to show you which ones for clarity, for reflection, and emotional processing. So look, I use tools like Notebook LM and Gemini to rewrite medical terminology into plain language. So to understand and translate the test results that he received from his healthcare professionals to generate diagrams of his treatment journey and also to help him come to terms with his diagnosis. So this was not really about automating anything. It was about making sense of information that was overwhelming, first of all, emotional and complex. Because I don't know if you're familiar with when you look at your test results, even blood test results, sometimes they are full of medical jargon, especially if they're written by a GP or by a surgeon. So you don't understand what that means. So you could Google everything, but then maybe Google doesn't give you enough information. So in this case, Gemini and Notebook LM helped him. So as you can see in this slide here, in the bottom right, you see it's an infographic generated by Notebook LM that summarizes his journey from the diagnosis to a new perspective of life. So in terms of let's say let's try to make sense of the good elements here for the generative AI use. AI enhances readability, understanding information, so you can adapt the content. You can ask ChatGPT or any other generative AI tool to write in a language that is clear, it's readable for different grades, different reading levels, so grade 6, grade 5, and so on. So it enhances readability, it enhances multilingual communication. It can be used for that. You can create visual explanations, so people who are maybe less prone to use um, textual information. Some software allows you to transform this visual explanation into audio and video formats. And so it somehow reduces the need for human translation for health information. Yes, the accuracy may not be there, but it's getting better. So in other ways, it democratizes access to knowledge. It's available 24/7, so it's on demand, and everybody, or potentially everybody, has access to it. So these are real benefits with real potential for reducing health disparities if, of course, used appropriately. Yes, of course, not everyone has access to the internet. Not everyone has the access to the tools, so computers, mobile phones, tablets, to use these tools. And this is one of the issues, of course, we can consider. But let's move to the bad in a few moments now. So what is not is all good news. The very few features that make generative AI useful and important are also making it risky. So as I mentioned before, when you Google a question, and this is the type of cancer that Luca Conti suffered from, that died from, you see the first line is the AI overview. So adenocarcinoma is a common type of cancer, blah, 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 and so on, which highlights the elements there where the sources of information is there. So this is what is happening now. So the AI overview is present in Google, and it is really Google Gemini generating a summary of the responses. So from the previous slide, we know that many people tend to read this overview and not go further. Some people might click on the source of information, but not necessarily. So this has, of course, a major impact on the way websites are ranked, are positioned, let's say, when it comes to search engine optimization in marketing, and how the information is received also and perceived. So AI overview might be true or not true. And this is usually that there's a disclaimer at the bottom of it saying, be careful that this information is generated. It might not be accurate, might not be true. So generative AI does not think, it does not understand the way we do, the way humans do. It does not know truth from falsehood. It predicts the next plausible word based on patterns. And the fundamental limitation of it is that however impressive the output might be, however good, apparently good, the overview is, it creates risks when it comes to AI use for health information seeking. So we need to a bit understand how large language models like Gemini, ChatGPT, Copilot, and so on work. So I linked here, and of course, I summarize in the next slides the main points of a very useful and easy to understand explanation by Marco Calzolari on YouTube made. So how AI works in a simple way. So large language models generate text, right, by predicting patterns from huge amounts of data. So the training data sets, what they call them. So they can produce information that sounds correct, but it's factually wrong. Or it can be factually wrong. And they express it with confidence. So when you read an output of ChatGPT, you say, wow, that's so nicely written, very assertive, right? So understanding what is behind it helps understand why hallucinations or mistakes aren't just anomalies. They're baked, in the architecture. So they're part of the architecture. So usually, so it's like we are chatting with a human, right? So we ask a question or write me a story, blah, blah, blah. And so the chatbot very quickly generates an output, the response, all right? But in reality, is the system executing a mathematical pattern matching loop. So they just put numbers, and they associate tokens to numbers, and this is what it means. So tokenization is I associate a number or a token to a word. And based on a process called vectorization, I associate this number to different vectors that are part of a three-dimensional matrix. And they look at correlations between different words, different tokens. So the engine, the prediction engine, generates a sequence of tokens of words based on probability. And through iterative refinement, they will produce a response, a sentence that is plausible based on the inputs that they have and the information they have from the data set, from millions and millions of texts that are similar. So AI prioritizes smooth flow and pattern matching rather than a perfectly written or a correct answer. So the engine picks a token, appends it, spins the entire cycle again, recalculates and repeats and verifies, right? So there's an illusion that this is really thinking. And if you can ask ChatGPT or any other software like that to think deeply, it shows you the processes they are going through, the software goes through. But the reality is that the engine is prediction based. So it's really sound matching between different tokens, different text elements. So without strong constraints, without boundaries, let's say, without your input as human, that the engine really gives you what sounds mathematically best, not necessarily correct. So in conclusion, a large language model is a machine that predicts words. And for this reason, probably we should be very careful of using it for something that is not text generation. So answering questions as if they were an expert. Now, here I provide a non-exhaustive list of intrinsic limitations of generative AI tools, large language models. So these are limitations that are non-solvable, let's say, by more training, and these are part of the package that comes when you use these tools. So inaccuracy and misrepresentation of information, so the potential falsification of data, of citations, references, and so on. And this is based also on my experience as a academic integrity officer when I see papers submitted to the university that are very well written, non-plagiarized, so completely, apparently, completely original, but the references are not. They're also generated, and which is the red flag, and we deal with. Then second element is about bias and stereotyping. So the stereotypes embedded in the training data sets, gender, genderized information or non-representation of vulnerable populations, languages, and so on. These are embedded in the algorithm, which is written by coders. So some humans have written those codes, and those humans have introduced some bias in the way they program the code behind it. Then, of course, there's problem of privacy and data protection. So the information you use on the tools are then stored and shared across the network, in the network, and then reused by the system. We need to be careful what you upload, what you share with those tools when you use them. Then, of course, the issue about copyright and plagiarism. So if you are reusing content that is generated, who's the source? Who's the author of that? Is that you? Is that someone else? Or is it a million of other people that used it before you? Then, of course, I mentioned this before, the risk of being self-automators or not using our creativity or critical thinking, because the tools generate content for you. And so we are not really looking at the best out of it. So these problems, of course, disproportionately affect people who are already vulnerable or information poor, I mentioned before. And then there's another problem related to the quality of the information that is out there. And probably you've heard about this term, the AI slops, low quality, the mass-produced content that is flooding online health spaces. This is strongly linked with another problem that we're going to talk in a moment about misinformation and disinformation. So there are content farms that generate thousands of health articles daily using AI that are optimized for search engines so that they are included in the AI overview, and they appear higher in the first pages, the first 2 or 3 pages of Google, so that most of the time people don't go past the 3rd page. So this is the one of the problems we have to deal with it. And then we have example of let's say state generated AI slops. I don't know if you've seen this. I'm not sure we have the time to play this video on Twitter. It's from the Secretary of Health, Kennedy in the US, in which he portrays himself as in a on a snack down against a Twinkie, and so fighting junk food. Um, it it might be a laughable thing at the moment, but I think it is problematic for several reasons I'm going to talk about in the moment. We're going to talk about the ugly. So another problem, as I mentioned before, the generative AI misuse is the amplification of misinformation. So if AI systems are not able to distinguish between what is true and what is false, they just look at the probability. If we flood the system, if we flood the database with disinformation, with incorrect information, then it's very likely that the generated output will be also influenced by that. So AI systems can absorb misinformation and then reproduce it again and again, which means that we are exacerbating the problem. So if you're using it and we're not debunking the myths, if you're not correcting the information, we are going to to spread it even more. So this creates a self-reinforcing cycle of error that cannot be corrected unless the user say, no, this is wrong. And you can vote, upvote or downvote the outputs too. So this might be on the users as well. This is something we can do. Eventually, the big problem here is that if everything we see is not real or it can be falsified, then people cannot distinguish real from fake. And many, in fact, stop trusting anything, so including credible sources of public health, organizations like WHO or UNICEF or local authorities that are sharing information online. If they're using generative AI inaccurately or improperly, they perpetuate this problem of lack of trust, of public trust. And then this, of course, creates confusion in the way we approach health information or any information in general. So let's now move to the ugly. So here I'm going to talk about the severe structural issues that go beyond individual risk and structural harms. So I'm going to talk about the inequities that are embedded in the system, deepfakes, the weaponization, and environmental costs of generative AI use. So in terms of structural inequities, we will talk about the exploitation of underpaid and overworked individuals who classify, who helped, or are still helping classify and label content. So they are part of the training models that are the basis for generative AI tools at the moment. Then, of course, there's a big problem of inequities I mentioned before. Not everyone has access to the tools and can use these tools efficiently. But also, most of the applications available are coming from big corporations, and these big corporations tend to be also politically aligned, or they're based in countries that have political connections. So we must ask ourselves who's benefiting from it. And so if AI tools are controlled by a handful of companies or oligarchs whose incentives might not be the benefit of the society, but of the world, and may not align with public health goals, then what do we do with it? So this is not political, but can be political, right? Then there's also the disinformation infrastructure, as I mentioned, and so state or parastate actors that can now create coordinated misinformation or disinformation campaigns at a very large scale. So they could distribute the health information, that is wrong, purposefully, designed to destabilize trust, to create chaos. It happened already in COVID-19 when some, let's say, bot farms and content farms spoke about connections between the COVID-19 vaccine and autism or other forms of neurodiversity. So there was a lot of discussion about that. And the more discussion were about that, the more people start thinking, well, there may be some truth about it, but it's false. There's no link. So public health advocates really cannot verify then where AI tools are being weaponized for propaganda, because of course these corporate disclosures are voluntary and vague. So corporations might not say how they address the disinformation that their tools distribute. And this brings me to the deepfakes, and probably you've heard about this term before. So deepfakes are videos or audio or pictures that are purposely displaying, credible sources, physicians, celebrities that are promoting false treatments or conspiracy theories, and they're increasingly convincing. So the quality of the images of the videos is going higher, and this could be very dangerous because once again the trust is lost. It's very difficult to restore. So this is an example from a few months ago. The effects of real doctors spreading misinformation on social media was an article on The Guardian talking about this on TikTok. Finally, or nearly at the end of this section on the ugly, is the AI weaponization. So some companies have been recently in the media attention now for being deployed in using weapons to kill people around the world. So the question we have now is, as users of these tools, is that are they transparent enough to say how their tools are used? Are AI companies really restricting government use for health disinformation campaigns? Are we putting ourselves at risk in general here? So there are growing concerns that AI models being developed for psychological and medical disinformation by state clients. So transparency in this case will be very important, but is limited. Last, of course, finally, the environmental cost. This is just an infographic that represent the fun facts about generative AI use and how big is AI's dirty secret. So how much energy they consume, how much CO2 emissions they produce. So this was a study for a few years ago about the GPT Model 3 that emitted about 500 metric tons of carbon dioxide of CO2. So that the equivalent of driving a car, imagine, from New York to San Francisco, so coast to coast, for about 438 times, And the water they consume to cool down the servers, because it's not just the energy to keep up the demand. As you can see on the top left here, there's 25,000 gigawatts. It's a measure that is very hard to even imagine. This is the need for Google to maintain their the servers active for their generative AI tools, Gemini. Okay, so we reached the epilogue. So here, if good gives hope, the bad gives up some caution, and ugly gives us some urgency. The question is, what do we know? What can we do now? What can we do as users, as more attentive users? So in terms of AI governance and public health, I think we can ask for establishing organizational standards for fact-checking of AI-generated content before dissemination to communities. Now, it's easier said than done, of course. During the pandemic, the COVID-19 pandemic, Google, so the giants, let's say, were able to, pushed by the WHO, the World Health Organization, to put at least under each COVID-19 related content on Google, YouTube, Facebook, and other tools, a message saying, "Be careful, this might be containing misinformation," and so on. So there might be a way to promote that. Probably on a technical standpoint, it might be easier than on a pragmatic standpoint. So we need to define clear responsibility chains and accountability when it comes to AI, especially when it comes to health and health-related information dissemination. So there are both legal and more technical aspects we need to consider, but we need to probably have transparency in that. So the question here is, who is liable if AI advice causes harm? It's been reported that people died because AI did not stop them from committing suicide. So who's responsible? Where is the responsibility? Is it the company behind it? Is it the end user? So the company is, of course, trying to blame it on the end user. So these are the issues that we need to consider. So who signs off of AI content? Who's responsible for it? And how are errors tracked and corrected? And what documentation is required? So we cannot say, "Oh, this is AI, is AI blame." Let's not forget about our role here, responsibility here. So we need clear governance, we need fact-checking, we need defined responsibility and transparent approval processes. Then from a clinical perspective, of course, we need to bring back the human into the picture. Human experience and contextual understanding are important, so these remain really irreplaceable. So we cannot substitute the human judgment, because doctors, they should know the patient history, the dynamics, and the cultural context, something that is really absent from generative AI tools. You can provide some context, you can write about it, but it's not as if these tools, generative AI tools, know that in depth. So just to highlight that. Ethical oversight in outputs in general. This is where We need to maintain, again, human oversight and review of all outputs for bias, medical accuracy, appropriateness, and cultural sensitivity before the deployment in health context. So we need to verify and critically appraise the outputs. So you need to probably have multidisciplinary review committees, clinicians, ethicists, lived experience members, and everyone who might have a stake in that information. So the question will be, could the AI output harm some vulnerable populations? Does it reflect a diverse community value, self-belief? Is it appropriate, if you want to use? Another important element we need to consider here and to promote and foster is critical media literacy for the media, so the journalists, the media, and the public. So we need trainings probably about media literacy, critical media literacy, looking at fact-checking, so verification of the resources available, check citations, and also then verify the claims that AI makes, so to avoid hallucinations. And then possibly pilot testing with the target population for comprehension and cultural appropriateness. So critical media literacy is a skill that requires training and time to build. And probably if we start earlier on, in schools, I have a small daughter, if we start teaching our children to be more critical about what they see and judge the sources of information, maybe we are on the right direction. And of course, we cannot forget in the context of health and risk communication, of course, the healthcare professionals, they need to be more proficient and more competent in AI tools, not only in biostatistics and epidemiology or other clinical areas, but they need to also be able to understand and use the tools that we talk about. So what, in practical terms, what can public health professionals do? Probably leverage the tools we have with the cognizant understanding that are biased. They have the limitations that we spoke about. And so we need to recognize and mitigate the risks, try to overcome the risks and then mitigate the biases. We need to protect vulnerable populations from the biases and the consequences of generative misuse. And need to advocate really for evidence-based policies and regulations about generative AI in general. So maintaining human judgment, accountability, and ethics as a central point, a central element in the health communication process and research. Now, talking about the research agenda, so here I propose a few points here I think are viable. So to support, let's say, evidence-based practice, we need research that keeps pace with technology change. So here I talk about misinformation surveillance. So we need surveillance systems that track AI-related harms, which are adverse to event reporting in pharmacovigilance, for example. So we need to see there's no surveillance infrastructure for misinformation at the moment. Yes, we have for viral spread, but not for misinformation. So maybe we need something about that. So when it comes to a vaccine adverse event reporting or vaccine misinformation in this case. Then probably we can do something about critical media literacy intervention. So to build this capacity, the skills, the recognition skills that, and this is probably something that I've already started doing with the generative resources for optimized learning and writing experience. So there are workshops, online modules, webinars we can do to diffuse the information and a good use of generative AI. Then we can think about pre-bunking trials, so like promoting a content before it gets exposed. So exposing people to weakened example or misinformation or disinformation to stimulate their reaction before that happens, similar to the inoculation theory for viruses. And then another important aspect here, I think we don't have to forget, is about AI tools reduce or exacerbate health disparities. We don't know that yet. I mean, we assume that this might be the case, but we don't know the extent to which this is happening. So the critical questions are: do AI really benefits mainly to those who are at advantage or those who are disadvantaged? Do they increase the digital divide, if you want, Or can we use digital tools to reduce this divide in a proactive way? So just to conclude, so generative AI is neither a savior nor a terminator. It's here to stay. So it is a powerful force reshaping how people search, understand, and act on health information. So the good, we saw that, shows how the immense potential for accessibility and empowerment of patients and individuals looking for health information. The bad reminds us that misinformation and overconfidence are real, present dangers that we need to account for and need to consider. Then finally, the ugly reveals the bigger systemic risks that we cannot afford to ignore. We need to acknowledge, we need to realize that um, they are there. So as public health professionals, as health communication experts, our task is not to fear AI, is not to forget about or to blindly adopt it, not to disregard it. It's really about making thoughtful choices, critical and very thought through decisions about this. So our voice, your expertise, your judgment matter. So let's shape the future deliberately, responsibly, and ethically together. So I thank you for your attention. I can stop sharing the screen now. And just a few credits about the generative AI tools used in this presentation. And thank you. Are there any questions? Let's see. There's a question about the difference between predictive and discriminative AI. I think it's very similar. I'm not an expert in computer science, but I say predictive and discriminative AI are very similar in terms of they predict an answer based on the content included in the data set, but it's really about discriminating between information that is already available out there. Are there other questions? Or reflections? I see this thumbs up there. Yes, Rebecca.
Hello, can you hear me?
Yes, I can.
Yeah, sorry, not great with this Zoom stuff. That was really fascinating. My head is still stuck well in the 90s, so this stuff it goes over my head and actually scares me a little bit. When you say that we have to sort of start working with the AI to make sure the right information is out there. So I work a lot in vaccinims. There's lots of misinformation out there. It's really difficult. I'm a nurse by background as well, but it's really difficult to try and counteract what people have ended up going down a rabbit hole on Google, for example. Is there plans, do you know, from uh, should it be something that's locally led or something that's government led nationally? Because it's a big field for, let's say, a little NHS trust or something to try and tackle alone. So what's your thoughts on that? Thank
Hmm.
you.
It's a big question. I think, I mean, research can start at the local level because it becomes a bit more manageable if you want to do like an analysis of content that is coming out, let's say, from a specific country, giving a set of keywords, for instance. So I think it needs to go up at national level and also beyond that. I know some countries, so the European Union is doing something about trying to put laws and boundaries, let's say, to AI and generative AI tools to combat misinformation. The WHO is also doing a lot about that. So there are international, extranational organizations that are operating on this field because we need to set boundaries, set clear guidelines. The problem is then, from a legal perspective, is accountability. So who's responsible for the content? Because eventually you need to look at where is the information published. So yeah, the search engine can bring it up or not or down depending on the search engine optimization of the content. But then eventually say, well, this page comes from East Asia, from China or whatever. So how and which entity, which government has the ability to determine whether they can censor that information? And So remove it from the search engine. So is it the search engine? Is it the company behind it? Is it the website owner? Okay, so these are some of the problems that appear to emerge now from a legal perspective. Um, so it is not an easy answer. And of course, then the question is if different governments have different views about what to accept, what to give credit to, let's say, and then um, who's controlling the controllers. Uh,
Yeah, good point. I was
mm,
going to say maybe things like licensing. So I know just minor stuff in the vaccine world, just some of the websites are accredited. So actually,
mhm,
you know
yeah.
that you go on and it's trusted, and that's really helpful
Yes,
to
yeah, that could be
advise people
something
of
that
that. Yeah,
it's more under our control, let's say. So if you're
sure.
working in
Yeah.
local authorities on NHS Trust, say the information that we publish is verified, is certified. Back in the probably in the 90s or in the 2000s, there was the HON code of information related to the quality of health-related information online. There was a HON code, HON. I think it was a Swiss certification. I don't know what happened to it, but this could be another way to say, we verify this information, we spend time and effort in doing this. So it's on us. And then what we could do also is to make sure that the people that read our pages are well aware about the certification, the quality checks. And as I mentioned before, we can do interventions to debunk the myths or pre-bunk the misinformation to make people uh, immune to misinformation. Not
Yeah,
easy to
I
do, but
totally agree. No, I totally
mm,
agree. I think there needs to be like I'm very much you need to handhold people. You need to actually go and see them face to face and maybe say, I'll use
possibly,
vaccines. This is the vaccine that your child's going to get, so
yeah,
on and so forth. You
yeah,
might actually see online that it says this is in this, but
mm,
this is the
mm,
data. So, and I wonder whether some of we need to teach and empower people to learn, like you're
yeah.
saying, learn that and understand.
Yeah,
I'll use vaccines,
it's
but
something we
yeah,
need to do probably, and we need to do as many times as we can,
sure.
as much frequently as we can. Again, it's the immediate effects might not be there, but so it takes time to convince people, especially those who are against it. It's probably easier to convince the hesitants, the so-called vaccine hesitants, than those who are completely anti-vaxxers because they live in their bubble, in their echo chamber. So whenever they go on social media, will probably see information that confirms their views. And this is something we cannot overcome unless we use different techniques.
Thank you. It's really helpful. Thank you very much.
No problem, Rebecca. Yara and Musawi.
Yes, thank you, Dr. Marco.
Hi, nice to
Um,
meet you.
Nice to meet you as well. Dr. Marco, thank you so much for the presentation. It was very interesting. Also, I have a very, let's say, hands-on, if you can say so, technical question. As
Mm,
someone like me who works in, let's say, okay, with you and agencies in the fields of RCCE, risk communication, community engagement,
hmm
in a way, strategic comms. I
hmm
work with healthcare workers. How can I really develop my experience in how embedding AI in my job, and let's say in
mm
social behavior change,
mm
behavioral insights? How can I do it? Yani, I'm really facing now. I'm reading the reports. I'm checking very slightly some tools, but I think I'm facing something every humanitarian professional is facing, that there's a lot of information out there, and I
hmm
don't know really where to start. So what is your advice on starting strategically and really taking off with things? Thank you.
mm.
I hope I was I was
So a
clear.
lot of information about how to use the AI.
How to
Is that
use AI and not to restrict myself, as
mm.
simple as to using ChatGPT on the
I
phone.
will try to use different tools. First of all, again, there might be ideological reason for you to stop using ChatGPT, for instance, because you know what the company is doing. There are other companies that do probably even worse. So it's a choice. It's ideological, but at the same time, it's also pragmatic. So I would say explore different tools and see which one you prefer, which one do you like the most. There are tools that are more open source than others. So there's one tool, I think it's called Mistral from, it's French, and you could even create a bit more, you could use it to download it, let's say on a server on your own. So you could use a generative AI tool within a more controlled environment, which limits the influence of decisions that are beyond you as an individual. In terms of tools that might be helpful for synthesizing a lot of information, I mentioned before, Notebook LM is very powerful. It's again Google, but helps maybe synthesizing a lot of information. So you can teach yourself how to use generative AI tools by using some of them and give you some advice and saying which one should I use. But then the question I will have is for what tasks? So for strategic communications, you need probably to develop a strategy, so you have strategic thinking. And I would say to some extent, might not be good to have to rely too much on an input from a generative AI tool, because you want some critical perspective that is mostly human, understanding which are the goals, which are the objectives you want to achieve, how you're gonna do it. You can get inspired by a generative AI tool, and you're saying what could be a strategic plan for this specific topic of this, how would you go about doing this? But I would rather not use the outputs as they are, because you tend to reuse the same things, so you will not find creativity in the average.
Okay.
If it makes sense. So for strategy development, content development, great. And I've done some sessions about creative outputs, and there's one of the sessions within the webinar at the end of July, at the end of this series in July. Very helpful, especially if you don't have resources, if you don't have the chances to talk to creative agencies. But even creative agencies are using generative AI tools nowadays to create some ideas, some concepts, and develop them into campaigns. Again, good for drafting, I would say, but you need to be very cognizant and aware of the biases that include. Just to give an idea, an example, if you if you search for nurse, if you say generate an image of a nurse or a doctor on different generative AI tools, see what happens. So there are a lot of biases that the machine has already embedded, or taxi driver, or healthcare worker, these things. That's why we need to be careful of that. But once we know the elements, once we know the limitations of the tools, we can overcome them, or we can challenge the tool to overcome those biases or respond in a different way. I know we can spend hours talking about this, but I hope it addresses your question.
Yes. Okay. Thank you.
I'm going to read now from the chat. And so we are 1 minute from the close of this webinar. So there's a Julia. Must say I have many concerns about the new health tools from OpenAI, Anthropic, and Microsoft. Will patients truly understand the issues around who controls their data? I have to leave now. Okay, thanks for the presentation. I mean, it's a very good question, and probably this is part of me trying to reflect on this on OpenAI ChatGPT Health. I'm not sure that people will understand about what it implies, and people are using ChatGPT as if it was Google now. But that's a status. That's really the starting point of this discussion. People are using it, so we need to do something about it, or we need to probably make people more aware and more cognizant about this use. And Nicholas, was a fascinating presentation. Country misinformation line. Who should decide what is truth, fact, evidence, data? Is it government, tech companies, etc.? You can basically find support for whatever you want somewhere. Who decide what is right, wrong, or correct misinformation? That's it is an ideological question, I think, but it probably covered from Rebecca's question before. So I think there's a responsibility from the organizations producing the information of verifying it and making sure that is accurate, valid, so that is true. So we need to define what is true. The problem, we are living in this post-truth reality where governments are creating propaganda information for many things. So that's where it's very hard to detect what is true from what is fake. So it takes a lot of extra effort, but we should promote really a better understanding of what is true, what is not true. So we need to fight misinformation every day, every night, whenever we can. Okay, so I think everybody is now leaving. It's time to close. Thanks everyone for your participation. And for those who have missed this, we'll be recording, and the recording will be available on YouTube. Thank you very much. I'll see you next time, next webinar.